Hey everyone, this is Mayor Robert Garcia. We are doing, of course, our city and media briefing. It's May the 15th, and we have our briefings every Monday, Wednesday, and Friday at 3 p.m. As we always do, después de las preguntas que tenemos, también we'll have a Spanish recap in español. Teresa Castillo Ayala from the Health Department will do our Spanish recap at the end. We also have, of course, Paola, who's doing our ASL translation, who's physically distanced right behind me. And then we're also going to have an update today on our largest industry in Long Beach. That is the Port of Long Beach. Our executive director and the CEO of our port, Mario Cordero, is here, and he'll be giving an update on the port in just a few minutes as well. So let me start with our latest numbers, and I do have a lot to report today. So first is our current positive rate is about 1,200, but I think it's actually 1,214 residents have tested positive for COVID. I want to remind folks that they've done this whole week. We do have a current increase in these cases, and they all tie to this backlog that we have had due to one laboratory. And so a lot of these cases we're getting over the last few days all go all the way back to April. And so we are trying to separate those cases out so we know exactly which day the cases belong to. But our medical folks are telling us that they are not seeing, from a daily perspective, that huge of a spike or a change. And so they're saying that it's not likely reflective of the current kind of testing situation in Long Beach. So hopefully that gets resolved. And so I just wanted to note that. But about 770 folks have actually recovered already that have COVID. So that is a significant number, of course. We had no one die or pass away today, which is, again, good news. But the total deaths are at 51 right now. And so we're always thinking about those families, of course. And there are about 56 individuals right now that are in the hospital. We've seen that number, of course, fluctuate. It's gone in the higher 50s. It's gone in the mid 40s, in the 40s, and that's kind of where we have been. And so we're really hoping that that number continues to generally stay flat, but we're really going to know in the weeks ahead as more has reopened. Want to start today by going through some facts and there's a lot of, during this crisis, misinformation that gets put out. I read some of it on social media that folks will send me messages. So I put out some important facts and reminders of what is actually happening. And I want to just review those because I think those are really important. And so here are some important facts for us to remember as you're reading and getting information about what's going on in Long Beach. And so I'm just going to clarify, during a pandemic, the truth and facts are really important. And so here's some of those clear ones. So the first thing I want to make sure people remember is that Long Beach has currently reopened all of its retail and storefront businesses that are legally allowed under state law. So I know most folks want us to open restaurants or barbershops, and I understand that it's devastating to owners and workers, but we're not allowed to under the state health guidelines. And so as of today, we have opened up all allowable retail and storefront businesses that are allowed under the state health law. The second thing I want to remind people of is that, yes, we have our own health department, and it's a great function for us, but the state health orders supersede our city and county orders. And so when folks want to know if we can move faster than the state, we can't move faster than the state allows. That's state law and the state health order. And so that's a clarification. I see a lot of people say we should do this or we should do that. We can't legally. And so even if we thought we could do so safely. The third fact I want to remind people of is that, yes, the state and the governor have put out guidelines to reopen restaurants faster. However, that program is set up for rural counties that are not dense and that may have no to a handful of deaths or cases. And so the only counties or only health jurisdictions that are eligible to move faster than the state baseline are all north of Sacramento and are small counties. So Long Beach as a city jurisdiction does not qualify. Los Angeles does not qualify. LA County does not qualify. Orange County does not qualify. San Diego does not qualify. And so I mention all of that because when you read folks that say we should reopen tomorrow, we can't reopen tomorrow. And that's because the state has clear health indicators that are not being met, and the city has our own. And so I want to make sure people remember that what the state law order does allow is for curbside pickup and some recreation, both of which we are doing. The fourth fact I want to remind people of is that Long Beach is currently in stage 2 of the 4-stage plan set out by the state. We can go no further on retail and restaurants until, number 1, the state modifies its health order, and 2, our health indicators remain flat with no large spikes. So even if the state allows certain uses and changes their health order, that does not automatically mean that Long Beach will then begin on that same day allowing certain activities. It means we've got to check our health indicators, and if those remain flat, then we move forward. The fifth fact to remember is that reopening decisions within each stage are made with the recommendation of doctors and health professionals, and our local officials are talking to LA County Health, California Department of Health, and the CDC all the time. So this is happening constantly. And so these decisions aren't being made because we feel like it or because we might think it's a good idea. They're being made based off of advice of the best medical professionals in the country and the state. And then the last fact I want to remind folks is that our positive working relationships with Governor Newsom, Mayor Garcetti, the LA County Board of Supervisors, and Orange County leaders are all beneficial to Long Beach. So I'm in constant communication with all of them because what happens in Los Angeles and Orange County affects Long Beach, and what happens in Long Beach affects Orange County and Los Angeles. So partnership is important. And these are some facts that matter. They are the truth. Science matters. And I know there's a lot of misinformation and folks that choose to create their own set of facts, and that's unfortunate. But I want to remind folks of those things. Now I want to talk about our current health order. We know that we are currently in our Safer at Home order, and as a reminder, because I'm getting this question a lot, there is no end date to our Safer at Home order. It is a flexible, open-ended date. The county does not have an end date. There was a discussion that it's 3 months out or till August. That was just a misinterpretation. So Long Beach, LA County, the state, there is no end date. It is an open-ended because it may be that we can move sooner or later than indicators allow. And so we don't know yet. That's what we're looking forward to in the next few weeks. And as a reminder, we are hearing some retailers that are really adapting to this new reality. Some retailers are doing really well online. They're selling items on Instagram. They're doing other online types of activities to help them sell. And we know that's not easy for all, but we appreciate those that it's working out for. And we're hearing this has happened. This happened for Mother's Day. It's happening for graduation gifts. And to clarify, again, those that asked about pet grooming, that is allowable, curbside only, dropping off your animal and then picking your animal up. And so those are all important things. Physical distancing is still required. Face coverings are required when you're out in public around other people or interacting at a retail spot. So please continue to do those activities. Want to also mention that there's a lot happening with the state budget, and I want to talk about that some as well. First, we all know that Governor Newsom just yesterday released what the state calls the May revision to the budget for the fiscal year 21 state budget. The state, like all governments across the country and certainly here locally, anticipates serious shortfalls and deficits. The state anticipates a $54.3 billion deficit due to the COVID-19 pandemic, and will have to go into reserves and leverage federal funding to help cover important expenditures around COVID-19. But thanks to the governor's real understanding of cities as a former mayor himself, he has, in his coronavirus relief fund package, decided to direct funding also to California cities, including Long Beach. And in fact, Long Beach is one of a handful of cities, because of our size, that will receive direct funding from Governor Newsom in his budget proposal. And that direct allocation from the state is for us to be able to deal with the medical challenges that we're having on the ground, the testing challenges, the cost of our public safety response around COVID-19. And so our city would be in a very difficult position financially had it not been for the governor's direct funding proposal. This is, by the way, on top of the difficult budget decisions we are going to make and have to make within our budget. And so I want to thank Governor Newsom. I want to thank his team. I want to thank the Department of Finance for the state, of who we've been talking to and meeting with constantly, for really delivering for cities and delivering for Long Beach so that we could cover these costs. And of course, now it's up to the legislature to pass this package. And we'll be working with our legislative partners and our Long Beach delegation to ensure that Long Beach and other California cities receive direct funding from the state to deal with these challenges. In addition to the effort happening at the state, which is really a bright spot for us right now, we know that today Congress is debating and hopefully will adopt and pass the HEROES Act. The HEROES Act is a large and comprehensive piece of legislation that I fully support, that would provide a variety of different stimulus incentives for the country. It provides more direct funding directly to residents, so you would see another stimulus check. Provides enormous funding for states for hospital and medical challenges, but it also provides direct funding to cities, and really all cities across the country. So any city over 50,000 in population would receive also direct funding through the HEROES Act. And so I want to thank our Congressman, Alan Lowenthal, for his support of Long Beach and our cities. I want to encourage the entire congressional California delegation, as far as the entire members of Congress across the country, will hopefully be adopting this. And now we need the U.S. Senate to also adopt the HEROES Act for this to be taken to the president and hopefully for a signature. And so that's where we're at. We'll continue letting folks be engaged and continue updating people on that issue, but that is happening and being debated in Congress. Want to also share that food distribution continues to go well. We want to thank Food Finders for providing bags of food to a bunch of locations, including Admiral Kidd Park, Cesar Chavez Park, and MLK, which actually happened just this morning. I want to thank Vice Mayor Andrews for being out there this morning. Thank you to CalFresh and all of our partners for food distribution. Want to, just as a reminder, let folks know that we have extended our parking, of course, enforcement on citations. We've done that weeks ago. Coming up this next week, we need to go through and street sweep for safety and for cleanliness all across the city. And it's important that cars get moved. Enforcement is in place now because we have to clean these streets, because with the trash and the debris is getting into the gutters and is causing us issues around water quality. And so please move your car. We have 3,000 free parking spaces available for you on the longbeach.gov website. And now, before I introduce our port director, I want to remind people also that our Economic Development Committee of the City Council, which includes the chair, Rex Richardson, the vice chair, Stacy Mungo, and the member, Roberto Urenga, are actually having their meeting at 4 p.m. after this update. So if you're interested in how we're doing with economic recovery, that will be also, you can watch that on the LBTV channel, as well as, of course, the longbeach.gov website always has links to these committee meetings, or you can find it on Facebook Live as well. There's going to be streaming as well. So thank you for those committee members and council members for doing that work. And now I want to introduce our port director. We know that in Long Beach, trade is a huge part of our economy, and we're having huge impacts on jobs and that economy. But we've got a great leader, our executive director of the Port of Long Beach, and our harbor department, Mario Cordero, is here. And I want to open it up to him to share how the port is working to continue to move cargo through COVID-19 crisis. So thank you, and Mario.
Well, thank you, Mayor Garcia, and good afternoon, everyone. I'm pleased to join you here today to provide an update on the Port of Long Beach operations in the midst of this COVID-19 pandemic. But first, I would like to thank the mayor for his leadership, not only with regard to his guidance regarding the navigating through this pandemic, the COVID-19 crisis, but of course assuring that as residents we stay safe and supporting the port that we're such, as mentioned, a big part of the economic engine, not only for the city, but for the state of California and of course the nation. I want to thank also the Joint Information Center and the Long Beach Health and Human Resources Department. They've done an excellent job to make sure that the residents in Long Beach here are informed with regard to the crisis that we're undergoing. And of course, utmost and what's important is to keep Long Beach residents safe and healthy. I'm happy to report that at the Port of Long Beach, we're working 24/7 to make sure this economic engine moves forward and moves the important commerce and cargo movement that is needed, again, not only to support the economy, but as a stepping stone, as a gradual recovery that we need to be making. Obviously, no one is going to be able to forecast exactly when that will be in terms of any maximized recovery, but nevertheless, we're making extreme efforts to make sure that we keep the cargo moving. It's utmost, again, not only important for the city, but important for the nation. The good news, as I referenced, the marine terminal operators are working day and night with regard to moving the cargo. And I want to thank, again, all the workers in the port complex, longshore labor, the IOW, that the men and women out there on the docks continue to load and unload containers that go to this complex, the nation's largest complex, containerized complex. Also, the truckers, a vital part in terms of the cargo movement here in the supply chain. And the railroads, the Class 1 railroads and the workers of those railroads, the mariners, and the workers at the warehouse distribution centers, all again vital in keeping the supply chain moving. So in essence, again, I'm happy to report that cargo is moving and the supply chain is healthy and moving in a way that there's no congestion and everything is fluid. As we know, the Port of Long Beach, on the average, moves 200 billion worth of cargo at this complex. And again, that cargo is well varied, diversified, but at this point, it's important that people realize that the cargo that's important today to move in an expedited manner is, of course, all that's related to medical supplies. And in that regard, that's a priority for the Port of Long Beach to make sure we expedite that movement. And I'm glad to report that the marine terminal operators are working lockstep with the Port Administration to make sure we prioritize the movement of medical supplies. And again, at the end of the day, even though our mandate is to move cargo, number one is to keep not only the workers safe, but make sure that that cargo moves in a sustainable way and with the COVID-19 crisis in a way in which, again, we're not affected or the workers not affected with regard to this virus, or at least try to mitigate the potential exposures. So again, I'd like to thank the stakeholders who are doing an excellent job now in terms of how we move forward on that. The port leadership, again, wants to emphasize the stakeholders in terms of working with us during this crisis. I've mentioned the IOW, an important component in terms of the movement of cargo. Also the marine terminal operators. And again, all the shippers and the carriers. And of course, the retailers. Obviously, as a nation, we're going through a significant crisis, but nevertheless, again, the retailers are making every effort to make themselves available to the movement of not only the sales that it takes that's important for the nation, as the mayor referenced. Now, e-commerce and online purchasing has become centerfold with regard to what we see now in terms of how cargo moves. Let me talk a little bit about our cargo situation in more specificity. Going back to 2018, it was a record year for the Port of Long Beach, a historic record year, moving 8.1 million containers. As we move forward to 2019, 2019 became the second best year for the Port of Long Beach. However, in 2019, we started to see the impact of the trade war, that is the discussion between China and the USA, which became, again, a significant impact with regard to the Southern California Port Complex, because as we all know, Port of Long Beach is ground zero with regard to trade with China. And this gateway approximates the closest approximation to the most important trade route to this nation, the Trans-Pacific trade route. So suffice to say that the impact of cargo volume began with the trade war. And now added to the COVID-19, we've seen now a significant impact with regard to volume. So I want to make sure that with our staff here at the Port of Long Beach, in light of this challenge that's before us, we move forward quickly to set up the Incident Management Team, the IMT. This is led by Casey Herr and Suzanne Plesia, who've done an excellent job in making sure that we have a roadmap to, again, not only transition with regard to the work environment as necessitated today, but again, to keep this essential operational moving. On the global front, the experts predict an 11% contraction in international trade. On the national level, right now, we're looking at a 20% reduction in container movement here in the United States. So obviously, these numbers are concerning. When we look into the economy, we're looking now at 37 million unemployed Americans who have now sought unemployment benefits. And as of right now, the U.S. Treasury for the month of April has paid out $48 billion in unemployment benefits. So obviously, again, we're talking about a significant, unprecedented crisis. But nevertheless, as we know, approximately 70% of the cargo that moves to the Port of Long Beach or moves through the port is considered cargo that is essential. Our April numbers, in terms of the impact of what I've referenced here, we had a 17% downturn year to year. And that's a double-digit downturn that we've seen now. April has been the most impacted month for 2020. If we look at 2020 overall, that is calendar year 2020, the San Pedro Bay complex has been hit in terms of a volume loss. Now, for the Port of Long Beach, that volume loss for 2020 so far comes down to 9%. And for the Port of LA, that number is 15%. So needless to say that we've had a cargo decline here at the Port of Long Beach. In the first half, in the first half of fiscal year 2021, we estimate that decline is going to translate to a volume reduction that will translate to a revenue loss of $10.8 million. If we look to the volume loss and revenue impact from the last 6 months of fiscal year 2020, that's about, on the average, another $10 million. So total, we're looking to a revenue loss of $20 million. So the collateral effect of what that means is not only volume loss at the Port of Long Beach, but of course how that may potentially impact jobs in the state. As referenced, we are the economic engine that accounts to, at a state level, 700,000 plus jobs in the state of California. And as the mayor may have referenced, 55,000 here locally. Now, I'm going to get to a point in terms of what we're going to do in terms of recovery. But I want to make sure that I give an update in terms of what those COVID-19 impacts at the Port of Long Beach. For the second quarter, we've had blank sailings here at the San Pedro Bay complex that equate to now a number of 48. Just to give some context to what that means, last year for the second quarter, there were blank sailings at the number of 10. So obviously a significant increase. And let me explain what a blank sailing is. Essentially, a blank sailing is a cancellation of a vessel in this trade route. So the vessels that only come from Asia, when they cancel a vessel, that basically means that we refer to as a blank sailing. That means that for that period of time in the string of movement of containers or container vessels, one vessel is not going to be coming here to the West Coast from Asia. That amounts to, on the average, a financial hit to the Port of Long Beach around $300,000 per vessel that's canceled. So needless to say, the message here is, again, we have now obviously seen what the impact has been to the Port of Long Beach. Accordingly, in terms of our budget, led by our Managing Director of Finance, Sam Juneblatt, has done an excellent job in terms of how we now move forward with a very prudent, responsible budget to consider not only the impacts, but again, going forward in terms of what we need to do at the Port of Long Beach to reduce our expenses. Another area I want to cover is the PPE challenge, and I'm talking about personal protective equipment. Fortunately for the Port of Long Beach, we've had some good networking with some of our partners, more specifically Cardinal Health. who's done a great job working with the Port of Long Beach of bringing in medical supplies from Asia in an expedited manner. We've also received assistance from companies like Next Trucking Company, donating PPEs, masks, gloves. Also recognition of Costco Shipping, a carrier who donated 4,000 plus masks to the Port of Long Beach. And of course, the crane operator or manufacturer, ZPMC, has also contributed to PPEs. So in essence, one of the big plans of action for the Port of Long Beach is to continue to procure at least a 6-month to a 12-month inventory of PPEs that we will need going forward. Because suffice to say that when we talk about the impact of the crisis that we're going through, this is not going to be short term. We're in this for the long run. So accordingly, we are moving forward with our budget in a very responsible manner. Now, having said all that, let me talk about a next item here. What are we doing in terms of recovery? Recovery is going to be utmost important for the Port of Long Beach, given that the economic engine that is responsible for moving commerce, how much it's relevant to not only the national GDP, but of course the local economy. So for that matter, on that note, we're going to continue with our capital improvement project investment. That is utmost paramount for the Port of Long Beach to continue that. Not only it continues our vision in terms of what that future growth is for the Port of Long Beach, but we continue to contribute right now to making sure that these capital improvement projects continue to produce jobs and men and women who are working on these capital improvement projects, 2 of which are very important here for the port in the city of Long Beach. The new iconic Gerald Desmond Bridge, which is set to open here this summer. And of course, the state-of-the-art terminal, Long Beach Container Terminal, that's 2/3 in operation already. That is, we're now working on the 3rd phase and last phase of completion of that $1.5 billion project. So when we look to our decisions that we make at the Port of Long Beach, there are 3 areas that we take very important or factors in terms of balancing out the decisions we make today as it relates to our budget. Number 1, what are the COVID-19 impacts? And I've laid out, again, very briefly what those impacts have been. Number 2, how do we position the Port of Long Beach at a point where we will recover, not only as a port, as a city, as a state of California, but as a nation? And number 3, the decisions that we make today, how does that impact our future growth and our operations that are it's a necessity for the Port of Long Beach to support? So with that, I'm very pleased to represent that we have moved forward with a very prudent, fiscally prudent budget. With regard to recovery, I want to give great credit to my team. I have Deputy Director Rick Cameron, who, when I talk about capital improvement projects, he's leading the way to make sure that we stay the course with regard to our investment in our capital improvement projects, which includes a $1 billion investment in rail. One of the premier projects that we're moving forward here is the Pier B on-dock rail enhancement facility. That will be a game changer for the Port of Long Beach, and that's budgeted at $170 million. Noel Hasegawa, my Deputy Director of Commercial Operations, he has led the Business Recovery Task Force. Again, vital to make sure that not only do we address the COVID-19 impacts of today, but that we prepare ourselves for recovery that's so important for this nation. Again, I'm not going to forecast in terms of when that recovery is, but I will say that I'm very confident that there will be a recovery. And I want to make sure that, again, Long Beach as a city and as a port leads in taking those incremental steps that's so important for business, so important for the men and women who are losing those jobs. And we want to make sure that we are a very important factor in terms of how we move forward to recovery. So with that, Mayor, I've given a very brief overview with regard to what we're doing at the Port of Long Beach. So at the end of the day, we will continue with our vision of operational excellence, with our vision of operating this port as an Amazon state of mind. And by that, I mean moving forward cargo in a way that's efficient, that's reliable, and that's dependable. Because at the end of the day, I'm proud to say that as the port of choice here, the Port of Long Beach, we have done a great job in our customer service with the beneficial cargo owners. And at this point, to make sure that we obtain their confidence moving forward, again, not only is good for Long Beach, but good for the Port of Long Beach. So despite the volume loss that we're having, I will say that, again, in the context, we're doing pretty good at the Port of Long Beach. I mentioned previously that as a country, we're losing 20% volume in containerization. So in the scope of things, what's happening here in Long Beach is, again, we're trying to mitigate as much as we can. So with that, we will continue with our plan of action to make sure that this remains an economic engine and the most important gateway for this nation as we move, again, the cargo that's so important for commerce and this trade route that, again, is the most significant trade route for the country, and that is the Trans-Pacific trade route. So with that, Mr. Mayor, I will conclude my comments on this update with regard to the Port of Long Beach. So thank you so much.
Thank you very much, Mario. And of course, the port is it's the second largest container port in the United States and brings in so much of America's cargo. So it's just really important that it continues to do well, not just for us locally, but for across the country. So thank you. And so we'll go ahead and take questions now from the media and the press, and then we'll do our Spanish translation at the end.
Good afternoon. Our first caller is Philip Zonkel from Q Voice News.
Can you hear me?
Yes.
Yes.
This question is for the mayor. On Wednesday, various California public health advocates hosted a virtual press conference about the lack of data collection regarding the LGBTQ community in COVID-19. One advocate from Equality California said it was appalling that the community has to beg for this information from public officials. Some advocates on the call also said this situation has been a failure of public leadership and reminds them of the AIDS crisis of the 1980s, when governments ignored the LGBTQ communities when they asked for help. Long Beach's health department has refused to collect this vital data. My question, Mr. Mayor, is you are in a position of leadership and influence. Why are you not advocating for LGBTQ data collecting at sites across the city?
Thank you. That part's not correct. I actually support Senator Wiener's bill that he currently has presented. I've shared that with the governor's staff as well. And Senator Wiener, I think, is doing a great job by doing the statewide bill. But I think you're right. I think county jurisdictions and health departments should have been collecting this information. And it took this pandemic starting to understand what the holes were in the collection of data. And so I know our health department is looking at and is trying to figure out the way to collect it the best way, because it's really important information. We should be collecting it. And I'm really glad the state's now going to have a statewide standard. And I think the governor alluded, maybe earlier this week or last week, that there were difficulties in collecting this information and having a statewide standard. And so I'm glad there's going to be one, and I support the bill. So thank you.
Next up, we have Valerie from The Post.
Hey there. So this is the third day that we've heard about this backlog as a reason for increase in positive cases. Can you give us any more information on what that backlog is tied to, and how long can we see an increase of positive cases that is attributable to that backlog?
You know, I don't know a lot about the backlog, to be honest. The only thing I know, and guys, correct me if I'm wrong, is that it's tied to one specific lab that LA County was using, and that the tests go back as early as April 1st, and so we're getting these huge kind of chunks of test results on every day from this one lab that should have been kind of spread out through other days. And so I don't personally know much more than that, except that we've asked the team to kind of try to decipher where those should have gone as far as the date, because obviously we have a tracker on the data dashboard of the positive cases. So I'm hoping that by next week we'll have had this all figured out and what the issues were with this lab. So I don't have anything more than that. Do we have any more details on that?
That's correct. They are working on updating the graph so that the cases will be spread out on the appropriate days.
Okay, thank you.
Next up, we have Melissa from The Post.
Hi, thanks for taking our questions. I have a question for the mayor related to the budget talk, the budget information that you gave. Can you say specifically how much the city is hoping to get from the state through the Federal CARES Act? And also, I wondered too if you could speak to what I'm guessing is the frustration of not getting funds directly from the Federal CARES Act from the federal government directly. I understand Long Beach fell just below the population threshold to receive those funds. And from what I understand, the city would have gotten about $80 million through the federal government, which I'm sure would have helped a lot with some of the deficits we're looking at. So could you address that?
Absolutely. This is a topic that I spend a lot of my time on every single day. Well, first, it's a good reminder as to why we should always be doing our census. Because our census that we do once every 10 years sets aside the number in our population to the federal government. We know that that in the last census, we were greatly undercounted. And so our population is obviously just shy of 500,000. Even though we're a top 50 state in the country, even though we're a big city, I've always said roughly the same size as Atlanta, Georgia, but we're not at 500,000. So when the Federal CARES Act got adopted by Congress and signed by the president, they set a 500,000 marker for direct funding to cities. And so if you were at 500,000 or above, you would receive direct funding from the Federal CARES Act, from the congressional package. If you were under 500,000, you would not receive direct funding, but instead, the counties would then, your money would go to the counties, and the counties would then, use that money to support cities. But that leaves out the big American cities that are dealing with COVID-19 head on. Left out Long Beach, left out Atlanta, left out New Orleans, left out Pittsburgh, left out Miami. And so when you're thinking about, left out Cincinnati, so when you're thinking about Oakland in California. And so all of these big cities across the country were left out of the direct funding, which was a huge mistake and a shame. And we worked hard, of course, to try to get included, but that decision got made, somewhere in Senator McConnell's office. And so that decision got made, and the city didn't get direct funding. And so we were very disappointed. Once we heard that the money would go to the counties, then of course we have now been working with the County of Los Angeles to try to get that funding, because the next largest city, we're the biggest city in California to not make the cutoff. So Sacramento, which just has over 500,000, barely, is receiving close to $90 million because they got direct funding. Long Beach, which is shy of 500,000, didn't get any. And so we're working with the county to receive those funds that they received by population. But at the same time, we worked and lobbied directly with the governor and the state, asking for direct funding for these larger cities, especially, that really need the resources to do the testing and the clinics and the services that we're doing for our community. So in the governor's budget, he allocated $450 million to California cities, and then broke that up and set aside half of that, which is about $225 million. I think this part has been published in the budget. That would go directly to cities between 300 and 500,000 in population. There are, I think, 6 or 7 cities in the state that meet this requirement, of which Long Beach is the largest, and of which Oakland is the second largest. And so one could, of the 225 million, we expect that we will receive a significant portion of that based on our population. And we know that though the amount that we will be receiving, we believe will be published by the Department of Finance and the governor's team, hopefully in the days ahead. The budget is a huge document, so they keep putting more information out. But we've been made aware that we are going to receive direct funding. It is significant. And now that we're going to receive this funding from the state, we're still working with the county to receive that additional dollars. And these, by the way, are dollars that were set aside directly to help cities. And so I want to thank Governor Newsom for his incredible leadership in getting these cities this direct funding. It would have been devastating to Long Beach and others had we not received this direct line item in his budget. And his staff has been great to work with. The Department of Finance has been great to work with. And I want to uplift, these relationships, having these opportunities where the governor is looking out for cities is really important. He was a former mayor. He understands the need that we have in Long Beach. And on behalf of Long Beach, thank you, Governor Newsom. It's going to go a long way to helping the city not just through COVID, but through the huge budget challenges that COVID is creating in the future. So thank you.
Next up, we have Haley from SoCal News Group.
Hi, yeah, I guess I just have a follow-up on the funding topic. Is there any estimate or ballpark you can give Mayor Garcia on how much Long Beach would expect to get from the city and the federal government? And can you also just speak a little bit more in specifics about how Long Beach would use that money?
I think I heard how much we get from different parts of money. So let me separate out. So there's obviously the congressional bill that already passed, which was the CARES 1.0 money. That's the money that went to the counties and to cities over 500,000, right? So in that pocket of money, the governor has set aside $450 million for cities. 225 of that 450 would be these 7 cities that are between 300 and 500,000. The exact number will be published soon, but Long Beach being the largest city in that group, expect by population to have a percentage of that amount that would be reflective of our size. And so we hope that we expect the governor's office to put out that number pretty soon. But you know, it's significant, and it's certainly enough to really cover a lot of the costs that we have had. Separate of that, in the CARES 2 package, or the HEROES Act that's currently in Congress, they're contemplating all cities over 50,000 would receive funding. So we would definitely be eligible. And it is significant. Their package is much broader, and it's really looking to give direct money to cities to cover a variety of costs that are COVID-related, health-related, hospital-related, economic relief packages, loans to small businesses. There's all types of opportunities there. And that package for Long Beach would be significant. In fact, it could be large cities, of which Long Beach is a big city. We're in the top 50. Any city that's in that top 50 would receive possibly hundreds of millions of dollars. I mean, it could be as much as 250, 300 million that Long Beach and other cities our size would receive for a variety of stimulus activities to get the economy moving and to pay for these huge medical and COVID expenses. But again, that bill is being debated right now in Congress, probably as this media coverage is going on, or this media event's going on, and it would have to still be adopted by the Senate. Did that answer your question?
It did, thank you.
Okay.
And that's it for our questions.
Okay. Are we doing any from, are we good? Okay, great. Thank you. I'm going to turn this over now to Terry Ayala Castillo, who's going to do our update in Spanish, who will do a summary.
Buenas tardes. Hoy es nuestra sesión informativa para el 15 de mayo. Quiero comenzar, como siempre, con nuestros últimos números. Hoy tenemos 1,214 residentes que tuvieron pruebas positivas de COVID-19. Si bien estamos viendo un aumento actual en números de casos esta semana, gran parte de esto se debe a los atrasos del laboratorio debido al aumento de las pruebas, y es posible que no reflejen la situación actual en Long Beach. Nuestros investigadores están trabajando incansablemente para que cada caso positivo sea entrevistado lo más rápido posible para obtener una imagen más precisa de cuándo ocurrió esta infección. Cerca de 770 personas se han recuperado y lamentablemente tenemos 51 muertos por COVID-19 en Long Beach. Agradezco hoy a la comunidad que está trabajando para mantener nuestras hospitalizaciones planas y nuestro plan de reapertura seguro. También hay información errónea y preguntas que están recibiendo la ciudad que voy a aclarar hoy. Los hechos y la verdad en una pandemia son críticos para combatir este virus, así que aquí hay algunos de esos datos. Long Beach ha reabierto todos los negocios minoristas y de tiendas que están legalmente permitidas por la ley estatal. Mucha gente, por ejemplo, quiere que abramos restaurantes y salones de belleza mañana. Entiendo que esto es muy difícil para los propietarios y trabajadores, pero no podemos. No está permitido por la ley estatal. Sí tenemos nuestro propio departamento de salud. Pero las órdenes estatales de salud reemplazan y nuestra ciudad y cualquier orden del condado. En pocas palabras, no podemos movernos más rápido de lo que permite el Estado. Sí, el Estado tiene una vía acelerada para reabrir los restaurantes más rápidamente. Sin embargo, ese programa es establecido por el gobernador para condados rurales con pocos o ningunas muertes y casos de COVID-19. Long Beach no califica, Los Ángeles no califica, el condado de Orange y de San Diego no califica. Entonces, en cambio, usamos la orden de salud estatal de referencia como guía. La orden permite la recogida de negocios minoristas en la acera y algunas actividades recreativas, lo que estamos haciendo. Long Beach se encuentra actualmente en la etapa 2. No podemos avanzar más en tiendas o en restaurantes hasta que, primero, el Estado modifique sus órdenes de salud. 2, nuestros indicadores de salud se mantengan planas y sin gran picos. Las decisiones de reapertura dentro de una etapa se toman con la recomendación de médicos y funcionarios de salud. Nuestros funcionarios locales hablan a diario con expertos y científicos del condado de Los Ángeles y de California. Hoy comenzamos el fin de semana después de abrir ciertas proporciones de nuestra economía y espacios de recreación. Por lo tanto, creo que es importante repasar algunos recordatorios sobre nuestra orden de salud más seguros en casa, porque no queremos retroceder en el progreso que hemos logrado para llegar a este punto. Es importante que en todos estos espacios continuemos a mantener la distancia física y usemos coberturas faciales. El gobernador Newsom lanzó su revisión de mayo a la propuesta estatal del año fiscal 21. El presupuesto anticipa una falta de millones debido a la pandemia de COVID-19 y gastará reservas aprovechadas a los fondos federales de ayuda para ayudar a cubrir los gastos relacionados con la respuesta de la salud pública. De estos fondos, millones van a ciudades de California que no recibieron asignaciones federales directamente, incluyendo Long Beach. Estos recursos serán críticos porque la ciudad continúa manejando la crisis de salud pública y estos fondos brindarán alivio económico a nuestra comunidad. Estamos increíblemente agradecidos con el gobernador Newsom por la asignación directa en el presupuesto estatal de Long Beach y otras ciudades de California y le agradecemos por su liderazgo durante esta pandemia de salud. En el Congreso se espera que la Cámara de Representantes vote hoy sobre la ley Héroes. Si el Senado lo aprueba y convierte en ley, esto podrá darnos un alivio a la ciudad de Long Beach. Gracias a todos los representantes de la ciudad como Alan Lowenthal por su ayuda y siempre pensar en Long Beach. La ciudad está asociada con Food Finders para proporcionar bolsas gratuitas de alimentos y recursos nutricionales a los residentes que lo necesitan. Los últimos días se distribuyeron 1,347 bolsas de comida en 3 eventos comunitarios. Estamos muy satisfechos con el éxito de estos eventos y estamos muy agradecidos a todos los que han ayudado con estos programas. Vamos a continuar buscando más formas de ayudar a las personas y familias de bajos ingresos. El próximo lunes 18 de mayo, reanudamos la aplicación de estacionamiento para nuestro programa de barrido de calles después de una amnistía de más de 2 meses implementada como un medio de alivio económico durante la emergencia de salud. Esto significa que comenzaremos a escribir multas nuevamente para mantener las calles libres de automóviles y poder realizar estos servicios de salud críticos para nuestros residentes. Hoy vamos a hablar un poco sobre el puerto de Long Beach, el motor económico de la ciudad. 1 de cada 5 empleados de la ciudad están conectados al comercio que el puerto maneja cada año. Gracias, alcalde Robert Garcia, y buenas tardes a todos. Me complace unirme a ustedes hoy para brindarles una actualización sobre las operaciones del puerto de Long Beach en medio de la pandemia del COVID-19. En primer lugar, me gustaría agradecer al alcalde y al Centro de Información Conjunta de la ciudad y el Departamento de Salud y Servicios Humanos de Long Beach por mantener informada a la comunidad y brindar toda la orientación para mantener seguros a los residentes. Me complace informar que también estamos trabajando duro en el puerto, asegurándonos de mantener el puerto abierto para facilitar el comercio. La buena noticia es que los terminales en el puerto están abiertos y están funcionando. La mano de obra en la costa descarga y carga barcos. Todos los trabajadores mantienen la cadena de suministro en movimiento. El coronavirus es un problema grave de salud pública. El puerto de Long Beach está monitoreando la situación las 24 horas al día, los 7 días de la semana, y continuará coordinando con nuestros socios locales, estatales y federales. En los muelles, los operadores de terminales y la mano de obra en tierra han aumentado la frecuencia y la intensidad de los esfuerzos de limpieza en áreas comunes y han tomado medidas para limitar las interacciones de cara a cara. El liderazgo agradece a todos los trabajadores que participan en todos los niveles para mantener el puerto abierto y mover la carga a través de la cadena de suministro. Mientras estamos abiertos y operando, la pandemia de COVID-19 sí ha impactado nuestro flujo de carga. En abril, nuestros envíos cayeron un 17% en comparación con abril del 2019. De acuerdo, abril 19 fue el abril más ocupado de la historia, pero aún sí estamos viendo los efectos de una menor demanda. El efecto sobre la carga continuará durante el resto de este trimestre. El año pasado, los dos puertos San Pedro y Long Beach y Los Ángeles vieron solo 10 salidas canceladas. En este trimestre de este año hemos visto a 48. En algún momento, cuando los funcionarios tomen la decisión de que es posible comenzar a abrirse nuevamente, veremos que la economía se recupere. Nuestro papel en el puerto de Long Beach es prepararnos para esta recuperación. Nos mantenemos en contacto cercano con nuestros clientes, mano de obra, ferrocarriles y camiones, así como con nuestros socios de la ciudad. Nuestros proyectos de mejoría de capital también continúan, ya que invertimos en nuestras instalaciones portuarias. La construcción está casi completa del reemplazo del puente Harold Desmond. Mientras tanto, también casi hemos terminado con la remodelación del terminal de Long Beach. La terminal va a ser la más avanzada del mundo. Cuando este terminal se termine en el 2021, tendrá la capacidad suficiente para clasificar como el 6º puerto más ocupado de los Estados Unidos. Eso concluye la actualización del puerto. Síganos en las redes sociales y visite nuestro nuevo sitio web en pob.com para más información. Gracias a todos por estar con nosotros hoy día y para más información visite el sitio web de la ciudad de Long Beach. Gracias.
Muchas gracias, and thank you, Teresa, and thank you again to Mario and Paola. And we want everyone to have a safe weekend. Please, if you can stay home, of course, stay home. If you go out to recreate, just please do active type of participation. Walk through the beach, run at the beach, walk through one of our parks. But stay safe. If you're around others, please wear a mask. And let's continue to keep hospitalizations low, and let's continue to flatten that curve. So thank you, and we'll see everyone on Monday.